makes me happy now. Alone time makes me happy. I like to see the water. There's something about it that just calms me. For me to tell my mother, I felt like I needed to take her somewhere where, you know, someone could sort of facilitate the environment for me. And so we went to this center. The lady who founded the organization tried to ease me into it, and I told my mom, and my mom broke down in tears. You know, she cried out, I have failed as a mother. And on the one hand, I felt so bad. But on the other hand, and I remember blotting out, you haven't failed as a mother. Please don't make this about you. This is about me. Now that I think about it in retrospect, I feel like maybe when she said she failed, it's not so much that I got raped. It was that I couldn't tell her. I don't know which, but...
What I noticed was that she started to separate herself from family. When everybody's out in the living room watching movies, she was always in the room lying down and not wanting to be dragged into anything. So she kind of like just removed herself from almost everything.
It's been tough because on the one hand, you have a family that wants to be supportive. But what prepares an average Nigerian to respond to a mental health crisis? Nothing prepares you for that. In Nigeria today, nothing. It's like, you want to get better, you have to learn to like summon the willpower. I'm like, no, it doesn't work that way. And so they're trying to lovingly, from a good place, be supportive, but it's also trying to understand, like, how is it that you can't get up? I can't explain. You're living with something that on the inside, even you don't understand, and then you are trying to explain to other people. How do you do that? And so everybody's stuck. I have gotten some kind of support, but I had to create that support because I needed an opportunity to be able to sit down with other people with lived experience and for us to share and for us to hold each other accountable and for us to not feel like, you know, I have to, you know, sugarcoat what I'm saying so that you can digest it. No, we're good. As raw as it could get. But that's a privilege that most Nigerians don't have.
Hey guys,
hey, what is it called?
Like housewarming.
Country in this on this our continent. Not
Togo. Republic of
When I did have a suicide attempt, one of the things that I was told on the bed when I was admitted in the hospital was that you do know that you've committed a criminal offense. Exactly, because attempted suicide is a criminal offense. The healthcare system is dysfunctional, that's a fact. Then you go into mental health care that is largely underfunded. It's all about treatment and curing, just the biomedical aspect. We haven't built enough of a framework for psychosocial support. It is medical practitioners that get to decide everything that has to do with the person with a mental health condition. We forget that the majority of what mental health conditions are really about is psychosocial in nature. Affordable housing, meaningful employment, good healthcare, good education. Poverty is always the key indicator across the board. If we do not solve a poverty issue, then we do not solve a mental health issue. The only way we're going to do that is if we begin to look at how we can do it whilst preserving the dignity of people who interact with mental health care. Because if I do not feel safe, then why am I going to approach it in the first place? I love talking about She Writes Woman. I started She Writes Woman after my first near suicide attempt. We're a movement that gives mental health a voice in Nigeria by empowering people who actually live with mental health conditions to tell their own stories, to co-create their own solutions, and to advocate for their own rights. It's about possibilities that exist beyond what you have been conditioned to believe about people with mental health conditions. People didn't see it coming. I didn't see it coming. People couldn't have thought that there would come a time when people with mental health conditions would speak so openly on social media in Nigeria and say that, yes, I live with a mental health condition. Yes, I live with depression. Yes, I see a therapist. Yes, I take medication. So what? And I think what people don't understand is that whilst what we have done is about other people, on a very deeper level, it has also been an anchor for me. It has kept me alive as well. I don't think at the beginning even I thought, oh, I'm gonna do this, and then it's gonna lead to this. No, it's just looking back and you're like, oh my days, I did that shit.
I tell her every time, whether she's on TV or she's winning an award, I'm too proud of her work. So, yeah.
We need to tell you what support looks like for us. We need to tell you what a system that is just and equal and fair looks like for us. We need to tell you what human rights respecting treatment looks like for us. We need to tell you what you should put in your bills, because you cannot know more about my condition than I do.